Good morning, people. My name is Nasketi Rungu. Today, I am going to introduce Dr. Bridgette, who has done oncology and she has specialized in it. And I decided to do this because there's a high rise of cancer coming up. So she can introduce herself.
Oh, thank you, Kate. Thanks for having me on your lovely forum. It's a pleasure being here. So let's get started.
Let's get started, people. Dr. What is cancer?
Interesting question. It's a mystery that has really gotten some people deluded, and it's a word that strikes fear and terror in a lot of people. But to break it down, make it as simple as possible. Cancer is a scenario whereby normal cells in your body that are meant to divide according to a certain preset code, decide to divide very fast and without following that code. So you wind up with a system where there are very many defective cells that have the ability to invade other cell types and get them to turn. So basically, picture a rebellion starting in a major city, say Nairobi. These rebels destroy Nairobi, but they go along to other cities and other towns surrounding Nairobi, recruiting new rebels and destroying those cities in turn. Yeah, so that is basically cancer. So it's malignancy that spreads
I hope you get
throughout.
what she's saying. Thank you. Let's go to the next one. What causes cancer, Doctor?
Interesting question. It's number one, it's rarely anything that you did or didn't do. So there's so many causes. So number one, there's your genetics. There's a genetic predisposition. For some people, there's some cancers that are tied strongly to your genes. Say breast cancer, endometrial, ovarian, pancreatic, some types of colon cancer. But that doesn't mean, okay, genetics is one of the things. It puts you at a higher risk than the population. Yeah, so that brings in the point of if there's a strong family history, you ought to go for regular screening. Then number two, there's lifestyle related issues. For example, if you lead a sedentary life, you barely exercise, you know the usual Nairobi life of wake up, get into your car, go sit at your desk all day, get into your car in the evening, drive to your home, sit on your couch. You get, like, we need to move a bit more. Yeah, so a sedentary lifestyle, which can lead to weight gain in some people. For women, there's some cancers that have been shown to be higher in women who've not breastfed, or for example, breast cancer.
Really? Breastfeeding?
Yes, breastfeeding protects you on so many levels.
Whoever is denying their children breast milk, you have heard from the horse's mouth.
There's the news. And then there are some that are also associated with other poorly controlled infections. Case in point, poorly controlled HIV has been shown to contribute a huge deal to some lymphomas, to some Kaposi sarcoma. Others like human papillomavirus, HPV. There has been demonstrated evidence of being directly linked to cancer of the cervix. So it's quite a lot. And then there are other things that are straightforward. For example, you cannot drink yourself silly and, hope not to get hepatocellular carcinoma. So smoking, drinking, sedentary lifestyle, poor diet, genetics. So, but one thing I'll tell you, nobody knows what causes cancer. Those are things that can tip you over. But whatever makes the cells rebel and decide to mutate, nobody knows. Nobody knows. So there's nothing you did or didn't do. Yeah.
Now, let me go to the next question. What are the myths about cancer?
Oh, a lot of them. Oh, yeah. Number one, African setting, whatever we could not account for, we always attributed it to higher powers, witchcraft. So cancer is not witchcraft. Okay, or if you firmly believe in witchcraft, then you'll come to me, I'll tell you, yes, it is witchcraft. Somebody bewitched you so that you get cancer. Right. But cancer is no witchcraft. Okay. Then number two, that cancer is a death sentence. If these things are caught early, they're quite forgiving. People have gone on to live 30 plus years symptom free. Yes,
Underline
cancer.
there.
Yes.
Did you hear that?
It's
you
never
can live up to 30 years
plus
if it is diagnosed
yes, if it's
earlier
caught earlier
and treated earlier.
Exactly. So it's never a death sentence, yeah? So things like very early breast cancer, it's caught at stage 1. People have gone on, lived good lives.
Wow.
Cancer of the
That is
prostate.
good news.
Men are not meant to die from it. You're meant to die with it. If it's caught on early before complications ensue, people have been shown to have very good disease-free survival. Your lymphomas, some childhood cancers, let's say your neuroblastomas, retinoblastomas. The key is catching it early on before it manages to wreak havoc, or before the sequelae multiply and it complicates, before your systems start failing.
I get you.
So it's never a death sentence. The third myth is bad. Okay, everything, including the water you drink, can get bad in the wrong quantities. So once the diagnosis happens, please stop starving your patients. Meat is not bad. If anything, during treatment, we actually encourage patients to get on animal protein.
Okay.
Yeah, because there's a high cell turnover. So your body is your body is trying to rebuild. Yeah, your body is trying to rebuild in as much as the cancer cells being destroyed. So please feed your patients. Give them animal protein. That piece of meat once a week won't make you have cancer. You get. For people like, hopefully me, who've not had a diagnosis yet, we can talk about reducing, not completely eliminating, reducing your red meat intake. You get? But
Daktari, how will we survive
once you're
now?
a patient, please eat. Sugar, okay, I won't even talk much about sugar. Sugar is meant to enhance flavor. Sugar is not food. Okay, so I won't even delve into that. But do not starve yourself. Do not make your diets miserable. Everything is acceptable in controlled quantities. And another myth that you need to cleanse your blood during treatment. Now, that leads to people actually messing up, people actually complicating treatment, leading to organ failure. So you find maybe a patient is on chemo, they're on some concoction with, I don't know, moringa, aloe vera. Come on, people. Yeah? It's never a death sentence, number 1. And number 2, feed your patients. Which other common myth is that? What have I not covered? But basically, oncologists are the friendliest people you will meet. And we like it when our patients show initiative. We like it when our patients actually speak to us. That way you get to learn together, because from the day you walk into my office, whether you like me or not, I will still technically be a part of your life until your dying day, whether it's 40, 50 years down the line. Even if I hand you over to somebody else, it will be a handover. You get? So they will still call me back, things like that. So, and it's something you will live with. So the more you learn about it, the more you know about your condition and embody it and own it, the easier it becomes for us to craft or to make a treatment plan for you.
Sure.
So we like questions. We are not the doctors who tell you I've said go. No, we like questions. We like hearing from our patients. Yeah, so feel free, read around, but come discuss with that. That way we get to expel some myths and some witchcraft being done in the name of, I heard from my step grandmother's cousin this and this. Yeah. So maybe types of cancers, just a quick overview. Generally there are 2 types: solid tumors and hematologic. Solid is breast, prostate. Okay. Solid, yeah. And then hematologic are those that involve your circulatory system and your lymphatics by extension. Yeah, that's where we are. Any other question? Oh my God, you guys are an interesting crowd.
If personally I was asked, I would say hematology is involving blood.
Yes. Okay. Hematology involves blood and the circulatory system. So that's why your leukemias come in, your lymphomas. Yeah. So these things are preventable, but even if they are not, even if nature chooses to, give you that, if that becomes your portion, if it's caught on early, there is hope. There is hope. You see, people are used to the sad sob stories. I know it's what sells. I mean, if you read a newspaper about a dog biting a man, well, that's usual. But if you read about a man biting a dog, well, you will want to click on that, yeah?
Sure.
Or a plane landing, a routine, but a plane crashing. So a lot of the stories that are out there are those of, the unsuccessful ones. Because that's what will evoke emotion, that's what will make people read up. So then there winds up being this very grim impression of cancer, yeah? It becomes feared. It's a disease like any other, under the right guidance, in the right hands. So thing is, there are also positive stories. Maybe it's about time we gave them a chance, but do not fear it. But that being said, we need to learn to watch out for it, be hyper vigilant, come for your annual medicals. I mean, tumor markers can help pick anything, your CEAs, your CA19-9. If there's anything in your body you do not understand, be it that persistent discharge that you've been managing for an STI constantly, please go have your gynecologist check it out, have your gynecologist do the sampling. If there is a swelling you don't understand, don't wait. Kenyans, we have a very bad habit of seeking medical attention only when we're in pain and when we've seen blood. Let's stop that. Go to a proper facility, where if you want to do background checks on the potential doctors they were going to check you, please do, but go be assessed by a proper doctor. Learn to get to the bottom of things, not just managing symptoms. That is how a lot of these things are caught early. That repeated ulcers that you've been nursing for about years on end, just have an OGD done. It could be a tumor in its early stages growing in there. Basically what you don't understand about your body, the way you take your car to the mechanic and the mechanic runs the diagnostics, same way, kindly come. It's funny how for healthcare we will take every other route, but then make a doctor's visit like the last resort. Yet when your car makes a noise, the first person you call is your mechanic. So we need to improve our health-seeking behavior, because if these things are caught early, you're home and dry. Now, key is early.
To take home. What would you advise the ones who are already diagnosed with cancer? They are still denying, and maybe they are discouraged from taking the treatment.
I know there's so many myths out there. And number two, treatment itself can be tough if you don't get the right guidance. I know chemo can knock you down, the vomiting, you feeling out of your element. But one thing I'll tell you, keep up the fight. And above all, you need to give your doctor feedback. Talk to your doctor. Reason being, treatments are customized. That is the word. For example, if we notice at a certain dose you're having severe adverse reactions, there's a way we lower it. Basically, keep an open communication loop with your doctor. We will tailor make. Notice the word is tailor make. Fitting it to suit you. We will tailor make your treatment plan. And then number two, please close your ears. Be totally deaf to people who've never walked the journey you've walked. If you talk to somebody who went through that journey, that is why we like support groups. That's why we actually encourage patients to get into them. There you hear from the survivors' actual mouths, their experiences. And trust me, no survivor will tell you nonsense like, eat, only greens for a full week. None of them. Because they've been through the crucible. They understand the importance of feeding well. They will tell you how to handle your hair falling out. So get a mentor of sorts that is a survivor, somebody who's been through that journey to hold your hand.
And are there groups that are created in Kenya, like someone can access?
Yes, there are so many.
So that you just don't go and look for
any random persons. There's Faraja Foundation. They're doing excellent work. They were affiliated with Cancer Care at Pisha Hospital, HCGCCK. So there's Faraja. There's so many. Just talk to your doctor. And then another thing about this treatment, we understand. We do understand, and because it's things we prescribe and we see every day, we see that all it can take on your financial life. Kindly open up about finances. This is one of the most it's one of the darkest sides of what we do. Okay. But a time comes when you kind of have to help somebody pick their medication, etc., based on what they can afford. So open up. Sometimes when we ask you what you do for work, what your finances are like, we're not asking to profile you so that we treat you in a certain way.
Sure.
No, we are asking because we understand what the journey ahead is. Yeah, the molecules that can go at even 5 million a pop a month. You see, it's not accessible to everybody.
And everyone.
But at the same time, that doesn't mean we do nothing for you. So remember, it's customizable. And we will be very invasive about a lot of aspects of your life. There's your marital life. There's even the life of your carers. You get? So it's an all-round diagnosis that has a lot of impacts on life, on learn to open up and speak. Then another thing that a lot of people don't get to pick is depression in the patients. Picture you're a man at your prime, maybe with 1, 2, or whatever number of wives, and then suddenly there's penile cancer.
Sure.
Yes, your penis has to be amputated. Or there's cancer of the prostate, and I won't go into details of the treatment, but those who are in it know. So you get, or you're a female, there's cancer of the cervix, a few complications have come up. So there's a lot. Like, view the patient as a whole person. Okay.
Sure.
Yeah. And just stop. Make your doctor your friend. That is why even when you're hunting for a doctor, it's kind of like a marriage. Get somebody who you're in sync with. You get?
Sure.
Yeah, somebody you can open up to, because some things can look very tiny to you, yet to us, they're big. You're telling me about, let's say, mood swings, about depressive episodes. Of course, apart from major depression, I'll immediately think, is the thyroid okay? Which, to like common man, it doesn't make sense.
Yeah, sure.
So your doctor is your friend. This is a multi-organ, multi-system issue. Learn to speak to them, even about the slightest issues. Yeah, so I think that's our time for now.
That is it.
Yeah.
I do appreciate Dr. for coming.
Just thank you.
Calling you and accepting.
Thank you for having me.
Easy.
This is beautiful.
Thank you very much. We'll catch up next time. Please follow up, and if you've not subscribed yet, do so, because we are going to have better things than this.
All right. Yeah. Looking forward to meeting you, lovelies. Take care of yourself.
Good day.
Remember to be kind. Good day.
Bye.
Bye-bye.